Give it a shot. Hello everyone, my name is Dr. Joel Rosen and I'm here with a lovely patient of mine, Roberta, and she has given me permission to talk to you a little bit about why she has come into our office and some of the experiences that she's experienced so far. So let's go ahead, Roberta, and can you tell us a little bit of the reason how you first came to learn about our office?
Yes, I was searching on the internet because I've been having so much pain for the last few years. I wasn't able to concentrate, or I was having stomach problems, thyroid problems. I was having trouble walking, sleeping, just doing normal activities. So I started searching on the internet, and you came up.
You found us. Okay, so then you came to one of our workshops.
Yes.
I remember. And what would you say about the workshop?
Oh, it was extremely informative. Extremely. I learned so much within a short period of time, and I decided to come and.
Okay, so what happened from there was after the workshop, you signed up for a couple of appointments
Yes.
to go through your history, your blood
Yes.
work. We did a neurological exam. And a lot of the times when I do a neurological exam, that's pretty enlightening to a lot of my thyroid patients, because you're coming in with a thyroid problem where you potentially have gastrointestinal problems, you have difficulty losing weight, you may not be able to focus very well, you may have some mood disturbances and brain fog, not sleeping, all of those things. But then all of a sudden I do a neurological exam with you and you find that you're not able to balance, or you may not be able to do coordinated movements, or you may not be able to touch your nose optimally, or I may touch your toes on one side of the body and you can't feel it, but you can feel it on the other side. So with that neurological exam, was that a bit of an eye-opener for you as to what else was going on?
Oh, absolutely.
Right.
Absolutely.
Okay, and so then you started as a patient,
Yes.
and now we're talking to you about some of the positive experiences that you've had so far. So let's just go through some of those things. What have you experienced so far?
Okay, well, first of all, which every woman wants to know is I've lost 15 pounds
Right.
within 5 weeks.
And that was not
And-
really one of our...
And that wasn't
yeah.
one of the goals,
Right, right,
obviously.
right.
My problem was that I was having very bad stomach problems, back problems, thyroid problems, rashes,
Right,
and my balance was way off.
right,
Basically, found out that I was hypoglycemic.
right,
On top of that, and I had neuropathy.
right,
And now I'm walking. I don't have the brain fog anymore. My thyroid seems to be functioning properly,
right.
and I love the program.
And
I absolutely love it. It's
Great.
made a new person. I've gained 20 years.
Right. Now, what would you... I'm really happy that this is going on. What would you say would have happened had you not started the program?
Oh,
'Cause
I
we
would
talked-
have.
yeah, we talked
Yes,
about
I
that.
would have gotten progressively worse, because every day it was another thing. Not sleeping, not eating properly, the compulsion,
Right,
of food. But the pain was, I have a lot of issues. And it wasn't diagnosed. My thyroid condition was from the time I was very young.
right,
It was not diagnosed until I was 49 years old.
right,
And of course I went on medication, and the medication, then it became stomach problems, and the stomach problems, I was on all the, acid blockers.
Right.
And it was just getting worse and worse. Then I developed the hypoglycemia. Then I developed, gastritis.
right,
I always had dry mouth,
right.
rashes.
Did you have any fears before you began? Any concerns or objections? One of the things I do mention in the workshop is if you have Medicare, or if you have Blue Cross, Blue Shields, or you have a form of insurance, many questions I get is this going to cover? And I told you in the workshop, And I told you in our initial exam that it would cover very little for some of the testing that we were going to potentially order. Some of the office procedures that we'd be doing would maybe cover a little bit, but at the end of the day, it was going to be an out-of-pocket investment for you. And so that's a fear for some people, or is this going to work, or I don't believe this guy. Was there any major concerns or fears or objections that you had?
At first, I said, gee, it's a lot of money.
Right.
You know, I said, but I put it in perspective. Some people will go out and go on vacation for a week or buy a new car.
Right.
This is my health. This is my life.
Right.
I've gained 20 more years. I feel so good now that it's all worth it.
Hard to put a price tag on that.
You can't put a price tag on health.
Oh,
when you hit 69 years old,
right.
all right, you put life in perspective.
Right. And also I think one of the very important things to say is I know when we had our initial exam, you were quite emotional because some of the cognitive stuff we were doing was an eye-opener for you, where, you know, here this lady who's been always sharp as a tack and is running a business and was great with numbers, and then all of a sudden you kind of know what you don't know, and whereas if you don't know what you don't know, you don't see it. But in that case, we pointed it out, some of these deficits and some of these concerns. If you could speak just a little bit about that, I think that's important to talk about.
Yes, because I've run businesses my whole life, and I have my own business, and then I took the business home, and I noticed I was forgetting things.
Right.
I was scared.
Right.
Because this wasn't me. I was forgetting phone numbers, which I have like a photogenic memory.
Right.
You know.
Do you have? And you mentioned that you have some of this in the family, some of these conditions in the family.
Oh, absolutely.
So it kind of became a concern, knowing that if this is a family.
Well, my mom ended up with the beginning of dementia, and that was scaring me.
Right.
And right now, I feel I have reversed almost every negative thing. You know, my balance is much better. I'm remembering things. It's all coming back to me. The neuropathy, no more stomach problems. No more.
That's awesome.
You know, it's.
What would you say also with some of the sacrifices that you have to make? Because it's not a magic wand where we're just going to wave it and everything's going to be great, but there is some looking in the mirror and making some sacrifices and changing up some of the foods that you're eating. Would you say that that's impossible to do? Something
No. I know it was difficult.
Right.
It's a mindset.
Right.
You have to put your mind there. It's a different way of life.
Right.
But I'm staying with it. And nobody says you don't go off once in a while. I was on vacation. Yes, I went off. I'm back now.
That's great. Is there anything else? Because I know you put together something to clarify your thoughts and maybe have any important things that you may not have mentioned. And you wrote it out quite nicely. Is there anything else that you want to add that you may think is valuable for people watching this? Okay.
Sure. Even with being on medication, I was always tired, couldn't concentrate, and still had intestinal pain all the time. I felt like my body was breaking down. I could not eat, sleep, do anything without pain. I'm sorry. I've been going to chiropractors on and off for 58 years, some good and others not so good. However, I have never met anyone as knowledgeable and good as Dr. Rosen. He is a pioneer, as far as I am concerned. He explains everything with ease so the average person understands. I am on a 3-month program with Dr. Rosen, and after 2 weeks I was feeling better than I have in 15 years. I am going into my 5th week and keep feeling.
It's okay. We can.
You're going to have to edit.
Yeah.
I am going into my 5th week and keep feeling better with each day. I have no pain. Dr. Rosen, David, and Sydney have been wonderful. I highly recommend Boca Health Care Center to everyone.
That's great. That's why we do this. That's fantastic. One thing that you did say in there that I think it requires a little bit of clarification. So, what would you say to someone that says, "Well, he's a chiropractor. Typically, chiropractors I associate with musculoskeletal complaints, headaches, sciatica, back pain, and here we are with a thyroid condition and some neurological involvement and gastrointestinal issues." And so what I tell patients is we look at it from an integrative approach holistically, and not just looking at it from take this pill or that pill, but figuring out the breakdowns that are occurring in your body and trying to address those one by one. But some people would still say, well, what is a chiropractor? How do they know about that? So you kind of mentioned it there, but if you can just elaborate a little bit on what you would tell someone if they said, well, a chiropractor doesn't know much about thyroid or these conditions that I have.
Well, I explain to people that chiropractors go to chiropractic school,
Right.
and medical doctors go to medical school, and they are learning the same thing in both places.
Right.
The thing is that the range that a chiropractor judges the body and all the workings is much more stringent so that they're able to do it from a different point of view,
Right.
and give you supplements versus medications.
Right.
And also they're trained more in nutrition,
Right.
and neurologically.
Right.
They do 300 hours more than a medical doctor,
Right.
so that they are able to
Right.
work with you better.
Great. Well, that's great. I think that's about as much as I'd like to share with everyone. I really appreciate you doing this for me, and I continue to strive to get you doing better and feeling great. So thanks so much
Thank
for
you.
sharing this.
And thank you.
Great.
I can't thank
Yeah.
everyone enough,
Right. Great. Thank